Imagine you're at your favorite cafe, sipping coffee, when suddenly an uncomfortable itch strikes your vulva. What do? It's a scenario many women find themselves in, grappling with the urge to scratch while in public. This itchy predicament isn't about cleanliness or lifestyle. It's a common challenge that countless women encounter. Vulval itching can strike anywhere, anytime, turning ordinary moments into battles of discomfort. Whether you try to ignore it or find a discreet solution, you're not alone in this itchy dilemma. So why does the vulva itch? Let's dive into the common culprits behind this annoying sensation. Vulval itching can be triggered by a variety of factors, ranging from infections to chronic conditions. One of the most prevalent causes is yeast infections. Known medically as candidiasis, these infections create a perfect storm of itchiness, often accompanied by a thick, white discharge. Yeast thrives in warm, moist environments, making the vulva a prime target. Moving on to sexually transmitted infections, or STIs, these can also lead to significant discomfort. Genital herpes, for instance, causes blister-like sores that itch tremendously before they burst and heal. Then there's Trichomonas vaginalis, another STI marked by itching and a distinct, often malodorous discharge. Not to forget pubic lice, commonly known as crabs and scabies, both of which cause intense itching, particularly at night. These critters are a nuisance, but thankfully treatable with appropriate medications. But infections are just the tip of the iceberg. Skin conditions like irritant dermatitis are also major players in vulval discomfort. This condition arises from direct contact with irritants found in everyday products such as soaps, detergents, and even certain fabrics. Chronic skin conditions like psoriasis, which presents as red, scaly patches, and inflammatory conditions like lichen sclerosis also contribute to vulval itching. These conditions create a cycle of itching and scratching that can exacerbate the problem. Hormonal changes are another significant factor. During pregnancy, breastfeeding, and menopause, fluctuations in hormone levels can make the vulva particularly sensitive, leading to irritation and itching. The vulva's dependence on estrogen means that any drop in this hormone can have noticeable effects. Lastly, let's consider other factors like urinary incontinence or gastrointestinal issues like Crohn's disease, which can lead to fecal leakage, irritating the sensitive skin around the vulva. Psychological stress, too, cannot be overlooked, as it often exacerbates itching, turning a physical issue into a more complex psychosomatic cycle. From infections to skin conditions and hormonal changes, the reasons behind vulval itching are as varied as they are common. Now that we know the possible causes, how can we manage this pesky itch? Managing vulval itching effectively begins with understanding and implementing proper hygiene practices. It's essential to keep the area clean, but gentle care is key. Opt for mild, unscented soaps and avoid aggressive scrubbing, which can exacerbate irritation. Pat the area dry gently rather than rubbing to minimize friction. For immediate relief, there are several over-the-counter solutions to consider. Antifungal creams can be a godsend for yeast infections, providing relief from the relentless itch. Additionally, soothing lotions designed for sensitive skin can help calm other skin conditions. These products are usually formulated to reduce irritation without harsh chemicals or fragrances. However, it's crucial to know when to consult a healthcare provider. If the itching persists or is accompanied by other symptoms like unusual discharge or pain, it's time to seek professional advice. While many remedies can be managed at home, never hesitate to seek professional advice for persistent or severe symptoms. Before we wrap up, let's quickly recap the main points about vulval itching. This discomfort is a common issue that many encounter, with causes ranging from infections to hormonal changes. Being vigilant about personal hygiene and selective about the products you use can significantly prevent or reduce itching. Most importantly, if the itching persists, consulting a healthcare provider is crucial to obtain a proper diagnosis and appropriate treatment. Remember, you're not alone in this, and understanding the causes is the first step toward relief. Take care and stay informed.